Cameroon Baptist Convention Health Services, Dr. Esa Abdijam, please also indicate your country. We may not be able to read all of your introductions because of the limitations of time.
Thanks, Charlotte. Yes, so today we're kicking off the partner briefing for local organizations. And the very first thing we want to highlight, and this is quite remarkable, is that 1,712 individuals, we'll see how many organizations in a minute, registered for this partner briefing, including 1,117 Anglophones. This is the Anglophone briefing. We'll be holding the briefing for Francophones. And the invitation to call was to leaders of local organizations. So this is quite a remarkable response. Now, you can see this is, I believe, Charlotte prepared this list of partner briefing registrants by country, and you can see the countries that have the greatest number of participants. But what we like to say is, if you are the only one from your country who is participating, for example, I see there is one individual from Norway, well, that places a special responsibility. Whatever the organization is that you may be affiliated with, it means you have a special role to play in Teach to Reach. Now, in terms of the types of organizations, you can see now this, I hope the text is not too small. We'll be sharing the slide deck if Charlotte hasn't already shared the link to the PDF. So you can see that there is actually, and this is consistent with the way we're defining local organizations, they can be either private or public. We know that at least in some countries, local government services are really community-based and serving community needs, are led by community members and accountable to the community served. And you can see that's almost a third of the participants in today's briefing, 1,712 individuals. That doesn't necessarily, some people, there may be more several individuals joining from one organization, but these proportions should still hold. 13% are CSOs. Other nonprofits actually represent 1 in 5, and then you have educational institutions. Other, again, a lot of maybe a lot of different categories that could be lumped together. And then you can see that primarily, again, a third of you work at the community level, a quarter at the district level, and this is also significant. Regional and national are also quite important. Now, 30% of participants in this briefing who shared their gender are women, and which means it's 70% men. So, and then Teach to Reach alumni, we do have over a third of you who have never participated in Teach to Reach before. So that's to give you a sense of who's in the room, and please, we encourage you to introduce yourselves. One of the main things you'll see with Teach to Reach, because it is about peer learning, is that we'll be facilitating and encouraging you to connect with each other. So as individuals, as participants in Teach to Reach, but also as organizations, and that is very much what we are hoping to contribute to. So just Charlotte, that maybe it should be the PDF file with a local that contains information specific to local organizations. Now, one of the key questions now, there is a broad range of themes because Teach to Reach has always been community-based. It is true that we started with immunization, but the scope of Teach to Reach has now expanded to encompass many, many different questions. The key theme, as you know, if you're here for Teach to Reach 10, is going to be a focus on climate and health, and specifically on the role of health workers in at the climate and health nexus, health workers as trusted advisors to the communities that you serve. And in your introductions, so Stephen Ombere, for example, do tell us if you are an alum of Teach to Reach, or if this is your first time joining, and you're free to and encouraged, in fact, to share your contact details. Teach to Reach is very much about meeting. We say meet, network, and learn, and the networking component is very important. So we're exploring a number of new themes, new to Teach to Reach. They may be in fact what your local organization is focused on and has been focused on for a long time. So we're especially interested. But I realize now that I haven't introduced the Geneva Learning Foundation. We are a Swiss nonprofit. I'm Reda Sadki. I'm the founder and executive director, and we research, develop, and scale up new ways to learn and lead against critical threats to our societies. Teach to Reach grew out of a program we launched in 2020 Over 3,000 health professionals participated. Initially, it was to improve the learning across in the health system. It grew into something much more. It's a regular event. It hasn't always been quarterly. I think that's important to highlight, but it's a regular event since January 2021. There have been 10 Teach to Reach events. The first one didn't have a number, was the Teach to Reach conference, and it's become a key platform for us and for really this network of capabilities that has emerged through the Teach to Reach platform. So the invitation to become a Teach to Reach partner is extended to National Ministry of Health teams, country and regional partners, and global partners, and we'll be very soon announcing the new partners joining Teach to Reach for the very first time from the global level. We've been privileged and honored to have as partners for Teach to Reach, anchor partners to having both Gavi and UNICEF, as well as a range of other organizations. But what I actually want to highlight, and what we want to highlight with Charlotte today, is actually the amazing range of organizations that have registered for this briefing, and that we hope that you will then follow through and determine if this is for you or not. And this is, I believe, Charlotte's organized this by country. So here we go. Don't worry, don't panic if you don't see the name of your organization right away. All right. And you'll see both Anglophones and Francophones are in the list. It's a long list. It's gotten a lot longer since the previous briefings where we also showed that list. All right, I think we're up to the M's, and you'll see again, we are including in our definition of local organizations, local government agencies. We'll speak in the Q&A if you have specific concerns or challenges around that. Now, what we've seen with Teach to Reach is really ascendant participation over actually more than 2 years now, but the last Teach to Reach was 17,662. That was Teach to Reach 9 last 13th of October. Who attends? So there's a global network of immunization, but increasingly other healthcare practitioners, and you can see that Teach to Reach reaches both government and civil society organizations, people working at the local levels. Half are francophones. There is a French component, and we'll be having the briefing in French right after this one. And you can see people work in quite difficult situations. 1 in 5 face armed conflict in their work as health workers. Now, I see a question from Sweeta Singh. So if you haven't participated in Teach to Reach, then you're not part of it yet. But the point of this briefing is to explain what are the 5 steps that you'll have to follow to become a Teach to Reach partner. Now, the point again is not so much the connection with us at the Geneva Learning Foundation, but really this is social network analysis showing the relationships between Teach to Reach participants. And you can see there are 2 clusters because there are Francophones and Anglophones. And this is Dr. Kate O'Brien and Dr. Ephraim T. Lomengo, respectively from WHO and UNICEF, who said this about Teach to Reach, that uniquely Teach to Reach provides a way to link health professionals together so that they can share experiences about what works. So what global leaders say about Teach to Reach is important, but for us at the Geneva Learning Foundation, what health professionals, participants, alums of Teach to Reach say about Teach to Reach is equally important. And here's Atahir Abubakar, a longtime TGLF scholar and leader in the Teach to Reach community, who said this: our collective experiences and passion can transcend borders and overcome even the most formidable public health challenges. Now, as you know, the focus on Teach to Reach 9, we already had a session on the health impact of for local communities on the front lines of climate change, and this is now with Teach to Reach 10 going to be the big focus. And we'll answer, Ojas Wari will answer the question about what are the requirements? We're defining local organization who can or cannot become a Teach to Reach partner. So on climate and health, last on the 28th of July, 2023, we held what we call a special Teach to Reach event. 4,700 health workers participated, told us that they are primarily folks working at the local level with local communities. They see themselves as part of the family or trusted friends of communities. And then they also told us that climate change, from their vantage point as health workers in the service of communities, consider that climate change is indeed a threat to the health of the communities. So if your organization works on climate and health, there are many different reasons why to become a Teach to Reach partner. We expect this event in June to be really a powerful moment for sharing experience, for consciousness of the global nature of this problem and the way that it's affecting people who are on the ground serving the needs of local communities. Now, alongside climate and health, as I said, there will be many, many other topics, and we will have space for local organizations that wish to express and share their knowledge, their expertise, their experience with others on the issues that matter to them. But some of the top issues we'll be looking at include neglected needs of women's health and neglected tropical diseases. There'll be a big focus, as has been the case since the beginning of Teach to Reach, on immunization. You'll be hearing from leaders of the movement for immunization, Agenda 2030. We'll be updating you on the Manifesto for Global Health, a document elaborated by over 1,300 health professionals. And then we'll be adding, listening to you and looking at what local organizations who participate in Teach to Reach want to bring to the table in order to define additional topics. So Teach to Reach really has 3 phases. First question is what happens before Teach to Reach. So before Teach to Reach, we do what we call Teach to Reach questions. You'll receive, once you're registered for Teach to Reach, whether as an individual or a partner, we'll be asking you to answer questions to share your experience. So what that looks like, for example, for Teach to Reach 9, we asked a range of questions. For example, have you been part of any changes with respect to prevention, diagnosis, or treatment of female genital schistosomiasis? So as you can see, the questions can be quite specific. Questions about the different themes and topics. And these questions, which you choose, you decide if you have any experience that you want to share. If you don't have relevant experience, then it's clear you should not be answering a question about, say, oral cholera vaccine if you've never used oral cholera vaccine during a cholera outbreak. So you answer the questions that are relevant to you, and we then give back to the community as a compilation, a collection of shared experiences. And this is what happens before Teach to Reach. So the learning starts before the Teach to Reach event in June. We begin the sharing of experience and learning from that sharing of experience. Now, we are building momentum towards Teach to Reach with a series of initiatives. The first one was for International Women's Day. So we, again, went to the women in the network and platform and Teach to Reach alumna and asked questions about what they would say to their daughters and other young women who wish to pursue a career in health or humanitarian work. Out of this, we published a collection in which 177 women health workers from really all over the world share their messages for their daughters and other young women aspiring to pursue careers in health. So this is just one example of how we're building up momentum to Teach to Reach. You'll be hearing about the Women Who Deliver Vaccines Collective, more about the neglected needs of women's health. We're about to launch another major build-up, momentum-building initiative ahead of Teach to Reach, and that's for World Immunization Week and for climate and health. We'll be every Teach to Reach participant will receive the invitation to take a photo of their daily work if they wish to document immunization, or to take a picture that shows climate change, the impacts of climate change on health in some way. So we're working with our first fellow photography, Krista Bode, on that, and you can find online the visual storytelling workshop that was held in March. Now, what happens at Teach to Reach itself? There, the focus is really on meet, network, and learn. Unlike what I'm doing right now, which is presenting information for this briefing, which I believe, and the reason we do this, We need to provide the information for you as an organizational leader to make the decision, do I want to become a Teach to Reach partner or not? During Teach to Reach, it's completely different. There are no presentations. Everything is focused on people sharing experience. You can see the dates here. English sessions will be on the 20th of June, French sessions on the Friday. And then the major focus is actually one-to-one networking, where you press on the button and you connect with someone else from the Teach to Reach community, who can be anybody, it's random, and share your experience with them. So for people who have connectivity problems, every session from Teach to Reach is then put into a podcast. And that podcast is audio only, so you don't need to be, even if you don't have the bandwidth or cannot afford to go on YouTube to watch the video sessions, you can still listen to them. It's kind of like radio, but you still need an internet connection. So that's what happens at Teach to Reach. What happens after Teach to Reach is we invite you to share your learning insights and reflections, and this goes into everything shared, again, goes back to the community. Our mission at the Geneva Learning Foundation is, in fact, to give back, and that is where the Knowledge to Action Hub comes in. What we learn, our collective and individual learnings, insights, go into slide decks that we share back with you. The experience is shared, goes into audio podcasts, goes into the formal reports, and I'm going to share some of the links, goes into something we call the double loop. So that is, I'm going to mark a pause here and go to Charlotte to see if there are any burning questions being asked in the Q&A or elsewhere that we can answer before. The next segment is actually, how can your organization become a Teach to Reach partner? Charlotte, any burning questions?
I'm not really read that. There is a comment and a question from Kien Gunyen Van that says, how can digital technologies join and contribute in these ambitions? So probably that's a preamble to what we are going to see next, how to partner with Teach to Reach.
All right. And I do see Martha points out that June 20th is World Refugee Day. Will we acknowledge that? That's a very good point. Of course we will, especially if there are local organizations that will become Teach to Reach partners for whom World Refugee Day is something significant, where they lead activities or take action. That is the very logic of Teach to Reach. Thank you, Martha, for that. All right. And Tumeni Mangi says, great updates and reach infos. Okay. Thank you. I'm just trying to keep an eye on the chat. And of course, there's also the Q&A. I see there are two questions. I imagine that's what Charlotte was pointing to. So we're going to leave time for questions. These are now the practical steps to become a partner. So you're doing step 1 right now, which is to attend a partner briefing. The second step, and I think we may have just lost Charlotte. Charlotte is, yes, and I think a number of countries in West and Central Africa are suffering from particularly severe connectivity problems. So we're well aware of them, and this is why we will share the presentation. And of course, the video will be immediately available right after the briefing for those who wish to catch up or watch something again. Now, here are the steps to become a partner. For step 1, you're doing by attending the partner briefing. You'll receive the partnership application form probably on Monday or early next week. The third thing, once you've submitted your partnership application form, we ask you to share the announcement to Teach to Reach 10. So this will be through social media, but also by whatever means you use within your organization. So this is across your networks. And then we'll ask you to tell us who you shared with. And this is actually quite an important step. So basically, you have to complete a short form in which you tell us, I shared this with the Teach to Reach 10 announcement with, 10 people on WhatsApp or on Telegram or what have you. And then we'll have the partner briefings. We haven't introduced her yet, but Maria Fernanda Manzan will be leading those briefings in the future. We may increase them. We did not expect this many organizations to respond. Over 1,700 local organizations responded to the call for partners. And so we may increase the number of partnership briefings, and we'll announce accepted partners at each partner briefing. Once you're announced as a partner, that means we'll explain what that means. Now, again, the way we think about it, Teach to Reach began with immunization and primary healthcare, but is now expanding to really take a more holistic view of what are the challenges that you face at the local level in your community. And so, if you care about these challenges that are being faced by your community, if you're a leader in a local community based or civil society organization, and if you're part of an organization doing work that improves the lives of the community, then you're eligible to become a Teach to Reach partner as a local organization. And again, I shared these in the beginning of the briefing, just to be very clear. What we mean by local organization is based in the community. The mission is to serve the community. It's led by members of the community, and it's accountable to the community served. And in at least some countries, that means it can also be public services, the local health clinic, if it's run by the government and serving the community and led by community members and accountable to the community, then would also qualify as a Teach to Reach partner. So, what are the issues that matter to you? Here's a kind of list of some of the issues, and I'm sure there are issues that are not there that may be really significant for you and the community that you serve through your organization. But we want to put some of those out there to give you a sense of the diversity of the space that we hope to create within Teach to Reach in June. Now, what change do you want to see in your community? There's some questions associated with that. Some of you may be doing things for your community, but you don't have an organization that you're affiliated with. In that case, you can participate as an individual, and you'll have occasion to share what you are doing for your community and what. But again, the Teach to Reach local organization partnership is for individuals who are working for change through an organization. Now, what best fits your organization? Again, this is not a comprehensive list. You can have a faith-based organization. You can have an informal grouping. You may be registered or not. You may call yourself an NGO, an NPO, a CBO, a CSO, or a VO. All are welcome within Teach to Reach. We'll have, of course, some guiding principles that you must confirm your agreement to in order to be admitted into the Teach to Reach partner family. Again, we recognize that you may have very different roles in your organization, and we'll be asking you for that information so we understand who you are, what your organization is and does when you complete the questionnaire to become a Teach to Reach partner. We recognize that organizations, of course, we're looking at the local level, district, maybe regional, also national. We saw a lot of national level organizations. For international level organizations, we have a different program which includes both partnership and sponsorship. Now, we also recognize that your organization may take actions in very different ways. So, and all of these are admissible as Teach to Reach partnership. We'll have some great. Now, we do want to say that we will have some fairly rigid and strict commitments and rules about Teach to Reach, both before, during, and after, and specific rules for Teach to Reach partners, whether they're global or local. The same rules are going to apply to everyone, but this, for example, is the standard release, which basically aims to ensure that Teach to Reach remains an event of the Geneva Learning Foundation that we can recognize and honor your contribution to it. So I want to mark a pause here, and we're at the 26-minute mark. We have a specific question. We'd love to hear for you to introduce yourself, introduce your organization. Many of you have done so in the chat. If you'd like to raise your hand, and I'll hand it over now to Charlotte. And we want to know what is the best example. So do introduce yourself, tell us who you are, introduce your organization, and tell us what is the best example of a successful activity led by your organization in the last year. And then we also want to know, will you be a Teach to Reach partner? So please do raise your hand to answer that question. Over to you, Charlotte.
Thank you, Reda. So my eyes are on the in the participants list, just to the list of attendees. Please go ahead and raise your hand if you'd like to answer the question that is on the screen.
Yeah, I suggest you start with the people who've introduced themselves in the chat and just go to them. They may not be, I'm assuming everyone is, okay. I see Julie Barro de Brito. Right? But I also, yes. Abdul Salam who's introduced
It's
himself in the chat. Yep.
Lilian Muchua. Okay, Rukaya Mumuni, please go ahead. And do start by
Okay.
introducing yourself, please.
All right. Hello. So I'm Rukaya Mumuni from Ghana, a nurse and a founder. Actually, I founded the foundation late last year in December. And to answer this question, it's actually based on my experience as a nurse. I work in communities, and I am aware of the needs of the communities, especially women, when it comes to access to sexual and reproductive health services such as cervical cancer screening and awareness. So what I did last year that was successful was to organize an outreach screening for 50 women in one of the deprived communities that I work in Ghana. So I was able to organize them in the community. And screening services for cervical cancer is very limited in Ghana. Actually, in Ghana, the district that I work with, there's only one health center, and that is the district hospital that is providing screening services for women for a population of 100 and something women that is living in that district. And that is roughly like inadequate. It is not enough to be able to get all these women screened and to be able to detect those who are suffering from cervical cancer. So one of our objectives as a foundation is to be able to increase access to cervical cancer screening. And we are focused on women living in deprived communities because they are not able to access these services. And one of the things that we realize is lack of awareness. They are not even aware. We that are able to go through school, awareness level is normally high in those who are educated, who are being able to educate themselves. And I have realized that those living in deprived community, women that are not literate, are not aware of some of these sexual and reproductive health problems. So as our main focus is in deprived communities, and last year was one of our big program. We actually organized a screening for 50 women that we screened for cervical cancer as part of the foundation's work.
Thank you so much, Rukaya. We are almost out of time, so I'd like to turn towards another person, Charity Cheptoris. We have quite a number of hands raised, and so warm welcome to you, Charity. Are you able to unmute yourself?
And just to say, Charlotte, I don't think Rukaya told us if she's going to become a Teach to Reach partner. It seems obvious because we know her, but I don't think we actually asked her. Over back to you.
So she's actually said yes, Reda.
Okay, wonderful.
Yes. I'm ready and willing to become a partner, because that is well, most of the things that we work with is in line with what Teach to Reach is doing. So we are ready to partner with.
That's great, Rukaya, because the other important question, especially if you know Teach to Reach already, is why did you take your precious time to come today for this briefing and so on. But I can't wait to hear from Charity, who I believe, unless I'm mistaken, may be completely new to Teach to Reach.
Thank you very much. I am very excited. I am really, really very excited. When I looked at Teach to Reach? I looked at everything that you're doing, and I admired each and everything. And first of all, one thing that I really want to appreciate about you is getting back to the community. There is a lot that happens in community, and it's not documented anywhere. There is no support. There is no. So for me, that is something that really caught my eye, and I am very excited. Now, I am from Uganda. And I have a community-based organization which is not even registered. It's called Integrated Community Project for Change. I called it Integrated Community Project for change, because when I look at my work, I do home visits, I visit homes to do sensitization and awareness programs. And when you go to people's homes, you realize that people are not only struggling with one issue. Somebody can call you for one issue, yes, but when you reach there, but there are quite a number of issues that they are going through. It could be maybe that you're going, sometimes I go to sensitized communities on malaria prevention, but when you reach there, someone is talking about nutrition, someone is talking about water issues. That is the background of my the project. We've not yet registered it, but I know that with the knowledge that I'm going to acquire from this platform, I believe I am going to do even greater things. One thing that so far we have done in the community where I come from the eastern part of Uganda, and the community where I come from, there are women who are still giving birth at home to traditional birth attendants. These are unskilled attendants who have never been to school. So we've really struggled as an organization, or as a CBO. We are trying to reach out to these mothers, especially young mothers. They fear to go to the facility. So I've been doing home visits and talking to these young people, trying to create awareness on the different services that are available in the health centers where we come from. And so far, there is a young girl who actually feared to go for services, and we managed to talk to her, and she accepted to go for antenatal. Until recently, I'm proudly saying recently, she gave birth after completing all her antenatal visits to the facility. And I'm sure we are using her as an example in our community, where there are so many girls who fear and deliver at home, to reach out to other young girls in the communities. It's just the beginning, and I'm sure we are going to touch the communities. Thank you very much.
I believe even if you are alone in front of your computer screen, I'd like you to put your hands together for the first two voices that we heard from Rukaya and Charity. We know there are remarkable activities being led, and it takes leadership in communities to make the difference. Charlotte, you said we're almost over time. We are actually formally over time already. I know we have, I believe we're ready actually for the French language briefing. I suggest we extend the session, given the numbers, the sheer numbers of organizational leaders that are here. This is a great way to kick off Teach to Reach. It's clear that there is not the same energy in the room as there was when we had global partners. The aim is, of course, to get all of us together around the causes that you in your communities care about, exactly the way Charity said it. I thought that was really well said. Back to you, Charlotte.
Thank you, Reda. And I also just want to thank those who are answering the questions in the chat and sharing what they are doing, what they did. So I see Sweater, you've gone ahead and unmuted yourself. And I'm sure since it's your first time of joining, please go ahead. You have the floor. Answer the two questions on the screen. Keeping in mind that there are many other people that want to speak and we don't have much time.
Okay. Hi, this is Shweta. And my organization is just a year-old, Tarun Bahar Social Foundation. And we are working in the area of education and health. And presently, the project which we are running is with respect to the sanitary napkin, cotton sanitary napkin. So here we get the, waste from the tailor, the cotton, the cotton cloth waste from the tailor, and give it to the ladies, and the ladies use the sanitary napkin, and they use it themselves. Presently, they're just using on their own. The plan is that we are also collaborating with hospitals and nearby doctors to promote it at the larger level.
Okay, and the next question we had for you is, why do you want to be a Teach to Reach partner?
Yeah. So, frankly speaking, I did not have any idea about this. So I just got the email and I thought that, I'll just sign it and understand. Now, after listening to all of you, I understand that, there are multiple partners who are working in the area of health. And it will be great to know about various, components of health and the ways to tackle it. while working in the community.
Thank you very much, Sweta Singh, for sharing that and for the work you are doing to promote women's menstrual health. I'm turning right away to Muhaiwe Ronald Zion. Over to you. You're already unmuted.
Yes, good afternoon, ladies and gentlemen, especially Teach to Reach Connect. I'm called Ronald Muhaiwe Zion. I'm a health inspector from Uganda.
Sorry, Muhari, can you tell us if this is your first time participating in anything in relation to Teach to Reach? Okay, wonderful.
Yes, this is my first time to participate, and I'm so eagerly that I will learn more because I've been following the newsletters that I've been sharing through the email. I am a leader of an organization called APSES, that is Association for Promotion of Education Services in Uganda. So far, what one of the best example of successful activities that I've done in the last year, we participated in health sensitization and awareness of communicable diseases, where we sensitized more than 500 people, including visiting their households. And for the results that we got, we received a report that at least 46 communities which didn't have a drying rack, they have so far now built them. So that is a successful story that I can give it, at least from the beginning where we are. We have tried at least to embark and teach, and it's at least these people can overcome the incidences of which can bring the communicable disease in the society. Then lastly, why do I want to be a part of Teach to Reach partner? One, I know that together we can. When we join to one hand or two hands together, we can overcome the challenges in the community for our people. Thank you very much.
Thank you so much, Ronald Mwawe from Uganda. And I think we can listen to two more persons, Prosi Muyingo, or there is Obiagu Ben. Are you able? Your hands are raised.
Yes, I'm able. Thank you so much for the opportunity. For sure, I've been waiting for this opportunity, and this is my third attending the call. As a Prosi, I'm a professional community health worker and an advocate. I'm supported by Living Goods, and I'm a CHW organizer within Community Health Work and Pact Coalition. As a community health worker, we educate disease prevention and immunization promotion to households, means we do home visits. As a Prosi, I take care for more than 200 community health households and more than 60 children under 5 years. I do maternal health and family planning counseling and planning. I assess illness in children under 5 for malaria, pneumonia, and diarrhea. I administer basic medical treatments. Then clinical referrals for complex cases. I followed up care at home. I served as community health advocate. Means I advocate for myself, for my fellow community health workers, and the community I serve. So, as we have been doing in the community and working as Living Goods itself, it supports more than 2,000 community health workers in Uganda. Whereby, as Living Goods, it has peer supervision. As Prosi here, I'm a peer leader. I oversee more than 20 community health workers. So I help them motivate them. I guide them in the work we do in the community, and I do home visits with them. So, as what I have seen here to Village to Reach, it's now like a four months attending. It's like you people, you are again in the community. As community health workers, we are the people on the grassroots. We know what hurts in the community. We have the challenges as community health workers. That forced me to join Community Health Impact Coalition to advocate for our rights and benefits. So as community health workers, we need to be salaried, skilled, supervised, and supplied. So that has forced me to join Teach to Reach so that I can get that power and help my community health worker. With the use of the knowledge I get from the advocacy course I did, that is 2 years back, I've managed to help more than 700 community health workers in my country and more than 1 million from 60 countries. We are in the same group. We share and solve our challenges, but the challenges we have as community health workers are not yet recognized. So by looking for that, many community health workers have failed to do the course because of the data they get is not enough to do the course. So I would like to take this opportunity to join Teach to Reach and get the help and help my fellow community health worker. I will be more grateful if we become your partner in health. Thank you so much. For any clarification, please don't hesitate to come out and ask me. Thank you so much for the opportunity.
Thank you so much, Percy. And Rhoda, I see there are some questions in the Q&A. Maybe we tackle those questions before we see if we can get one more person to share.
All right, I believe Charlotte may have been disconnected. I'm not sure. Charlotte, are you back?
Yes, Rhoda, I am back, but
right.
It looks like my connectivity is still not good.
Okay, we're at the 45-minute mark. This is a first touch point. I just want to make sure that everyone, if there are any unanswered questions, okay, let me try to work through the questions. Muhare actually says, do you normally provide newsletters? Yes, there will be lots of, actually, once you register for Teach to Reach or as a Teach to Reach partner, expect to receive a lot of emails. If it gets to be too much, just unsubscribe once you understand what you need to do. But there are a lot of emails, including the Teach to Reach questions, and I will be giving back a lot to you. Now, Debukola Areo says, how can we connect within a zone or community? Yes, so I actually gave, for those who joined right at the beginning, we have country groups within Teach to Reach and across the TGLF platform. Step one is to join the Teach to Reach announcements channel, so that's the best way to do it. That's a great question. Yesua Aliki, what will be the form assigned for willing partners to express their interest? So you'll be receiving that. Check your email. It'll be sent to the email you used to register for this briefing. Thanks, Esajama, for sharing your publication. Lilian Mutua says, can we also discuss importance of community engagement to change perceptions, attitudes, practices around decision-making around immunization and other health agenda using the human rights-based approach? So Lilian, if you are part of an organization that works at the local level around these issues of demand for vaccination using a human rights-based approach, then yes, not only can you come discuss them as an individual, but what's different is that for the very first time, we're inviting you and your colleagues who also work on these issues to actually, come and bring that theme, that topic to Teach to Reach in June, and you'll have the opportunity to also host your own workshop. Now, of course, you'll have to apply, and we'll be setting up a kind of review committee to decide that, but we are able to accommodate a large number of workshops. Of course, you'll also have to take on the responsibility of making sure your membership, your networks are informed of Teach to Reach. It is free, of course, for health and other development professionals in developing countries. And so we would expect Teach to Reach to really be, you will have a corner, a room of your own at Teach to Reach. Now, Tumushabe Prosper says, thanks for the presentation. How can I receive your funding opportunities? So there are no funding opportunities associated with the Geneva Learning Foundation through Teach to Reach, but there will be global funders, global and regional and national funders who attend Teach to Reach, including national members of national teams from governments who attend Teach to Reach, and we have seen a number of cases, situations in which we have seen Teach to Reach and other TGLF participants come away with connections, introductions, meetings, and so on that help them with their funding goals. What is the forum you have for international organizations? So Teach to Reach is open to international organizations. The reason we're doing this specific briefing is because it's the first time we're opening up to partnerships to local organizations. But part of it is we realized of the 17,662 participants from last October's Teach to Reach 9, a significant proportion of them are actually organizational leaders in their local communities. A question from El Bethel Alimo, how can I be part of this as a researcher? So the call for local partners will include actually specific questions for those of you who are involved in research, working for an academic, on academic research, but also open to citizen science. So individuals who want to contribute to research to improve the well-being of their communities, and we're working with partners to provide those kinds of opportunities. A question from Charity Chiptoris, do you offer training opportunities to members? Well, Teach to Reach is a different kind of training. It is not about someone presenting information to you that you receive and then you have to try to figure out what to do with it. It is about really sharing your experience, Charity. So at Teach to Reach, I may know I may know a few things about the field of education, but I'm actually just as interested, Charity, in your experience of how in your community you help people learn and you see others learn and you organize your own learning. At Teach to Reach, you and I may be in a one-to-one networking session where we'll have the occasion to discuss how we can share in these ways. And the last question I see, at least in the Q&A, is from Obiagu Ben, who says, I want to know if there are networking on reproductive health and family planning in community level. I'm interested in it. So Ben, absolutely. So if your organization is working on these issues, and you will be able to, at Teach to Reach, connect with other individuals, but also other organizations working on these issues before, during, and after Teach to Reach. All right, I see one more question coming in from Samuel Mutambuki. So this is through the Q&A function. He says, how do you raise grassroots organization capacity in terms of knowledge and skills to be able to respond to emerging issues in the community? Well, I don't have the answer to that, and I think I would be wary of anyone who claims that they do. I would say, Samuel Mutambuki, that actually through Teach to Reach, we're hoping that you and other leaders of community-based organizations, and including government agencies, can contribute, nourish the dialogue around that to see how through networking, by being networked, connected to one another, and trusting one another, learning from one another, we can actually strengthen that grassroots organizational capacity. So I think that is it. We've gone way over time, but we do that. We ask you, for those of you who are with us in the studio, and even in this case, we didn't live stream this briefing, but when we do live streams on YouTube, Facebook, and so on, we'll ask you if you wish to extend the meeting, the discussion, because it is meaningful to you. And if an insufficient number of people say that they want to continue, that is when the meeting ends. Again, it is in your hands. Once again, thank you. I want to thank Charlotte, of course, for her facilitation despite the connectivity issues. And we hope this has given you a taste of what Teach to Reach is all about and help you determine, first of all, in your own mind, you may have to go back to your organization and discuss with other organizational leaders. If this is something you want to engage in, it is entirely up to you. But rest assured that if you decide to join, you will be warmly welcome to the Teach to Reach family, and I'm glad you got to hear a few of the voices of Teach to Reach alumni. Again, an incredible occasion today. 1,712 participants registered for this partnership briefing. You can see 368 from Nigeria alone, 219 from the DRC, 98 from Ghana, and you can see many, many different kinds of organizations were represented today. This is all the head of Teach to Reach. Let me just take you. We have, of course, the French language briefing in a few minutes, but I do want to show you just search for Teach to Reach 10. You can see here. There's also additional information. And again, if you probably one of the best ways to connect right away is to join the Teach to Reach announcements channel. If you are struggling with connectivity, you want the podcast here. And if you are interested in learning more, you can have here. We just published this morning the Teach to Reach 8 report, really the synthesis of what we learned at Teach to Reach 8. And if you'd like to know more about partnerships and see some of the sessions from previous Teach to Reaches, then you can use the link I just posted. I think that is it for today. A warm welcome to those of you who are new to the Teach to Reach family, and to those of you who've trusted us and engaged over the last 1, 2, 3, 4, 5 years even. Really warm thank you. And I see the news that the Telegram link is expired. Let me see if I can fix that. All right, we'll share out the link in the in the follow-up. Thanks, Eric, for being for prompting that out, for pointing that out so promptly. Thank you, and goodbye. I've got a new link. Thanks for your patience. For those of you who are still here, there's still many of you in the room. All right, take care. I hope to see you before, during, and after Teach to Reach. Bye-bye.